So we're going to start with joint play assessment of the hip. We're going to do a lateral glide on Billy's hip. And even though the loose pack position of the hip is 30 degrees of flexion, 30 degrees of abduction, and external rotation, this is one of the joints that you really don't have to have in the loose pack position for your assessment. Traditionally, you have your patient in hook line. I'm going to be putting my hands together close to his bikini line, and I'm going to be delivering a laterally directed force or a force away from him. And I'm going to offer just a little bit of counter pressure with my shoulder. So it'll look something like this. So I stagger my stance, and I'm just going to give a little pull. Now I'm assuming that his body weight is stabilizing him, so I can actually kind of open up that space. To treat this, it would be a lot of work for me to do that. So I treat it with a mobilization belt. So I keep Billy in the same position. I'm going to put this right there. My table's a little too high. You want this line to be parallel. Okay? We're going to assume I'm standing on the floor. Yeah, because you want this line of force to be parallel. So what I'm going to do is I'm going to offer counter pressure with my hands, and then I'm just going to weight shift to my back leg and pull and get a laterally directed force. And typically when you do hip mobilizations, you kind of do them slow and controlled like this. You can take them to their barrier. You can do a little oscillation like this. But as a general rule, I feel it's almost better to kind of go slow and creep them out. So that's a lateral glide.